Okay, good morning. Welcome to FATE's focus session on fighting cancer with off-the-shelf iPSC immunotherapeutics. My name's Dan Shoemaker. I'm the CSO at FATE. I'm going to be the moderator of this morning's session. We have 4 great speakers lined up for you who are going to take a deep dive into the science behind using iPSC technology to generate the next generation of safe and effective iPSC-derived NK and T-cell cancer immunotherapeutics. Before getting started with the talks, I'm going to give a brief overview of FATE Therapeutics. We are a publicly traded company, so here's the required forward-looking statement. We are located in San Diego, California. We're a clinical stage biotech company with 68 employees spanning research, clinical, regulatory, quality, and manufacturing. The focus of our company is developing a disruptive pipeline of programmed cellular immunotherapeutics for oncology and immune disorders. FATE was founded 9 years ago by Len Zahn, David Skadden, Sheng Ding, and Rudolf Janisch, household names here at ISSCR. Starting off, FATE is first and foremost a cell therapy company, and we focus on NK cells, CD34 cells, and T cells. And we are big believers that the biological properties of the cells that are adoptively transferred into patients make a big difference and have profound impacts on patient outcomes. Our strategy is to use ex vivo cell programming, where we incubate cells with small molecules and biologics ex vivo prior to administering them to a patient, with the goal of enhancing the therapeutic properties of the cell therapies. What's shown here is an example of a small molecule that was originally identified in Len Zahn's lab that enhances the homing and engraftment properties of CD34 cells in the setting of hematopoietic stem cell transplantation. Shown stained here is the green is a staining for CXCR4, which is a key homing receptor. And what you can see is before and after this 4-hour incubation with a small molecule. So this really shows that we could impart profound biological properties into cells in a relatively short engagement period with these small molecules. Another interesting thing about, or powerful thing about this platform is that by using different small molecules in this programming step, you could create cells with different biologic functions. So shown here in red is, again, a CD34 cell, and red has been stained with an antibody to PD-L1, a very potent immunoregulatory protein. So we are developing this cell in the setting of type 1 diabetes and autoimmune disease, again with this idea that the pharmacologic properties of cells can be significantly enhanced with this ex vivo programming strategy. Shown on the bottom is a NK cell that's been programmed with small molecules through a 7-day culture period. We're developing this cell in collaboration with Jeff Miller at the University of Minnesota. And basically it's been programmed to have memory-like properties and also high levels of CD16 expression. We're going to be taking this cell into the clinic in the area of AML initially, followed by solid tumors. We also have an interesting collaboration with Therapeutics in Seattle, where again we're applying the small molecule ex vivo programming approach to enhance the therapeutic properties of their CAR T cells with an eye towards improving the persistence and cancer-killing abilities of these cells. So the vast majority of the cell therapies that we work on, and actually the entire cell therapy field, utilizes patient-sourced cells. And the advantage of this is that they are readily available, albeit sometimes in limiting numbers. However, there are also some challenges with using patient-sourced cells, which is highlighted here in this next slide. The heterogeneity of the cells that you get from a patient can be a challenge. In the case of allogeneic sourcing, HLA matching can be a challenge. The time requirements. In many cases, you don't have the time to isolate the cells and manufacture cell therapy for a patient in immediate need of a therapy. Finally, this approach is not very scalable. Many of these procedures are done at an N of 1 manufacturing level, which can be challenging. And also, as we go to incorporate genetic engineering to enhance or to program the functions of cells, using patient-derived cells in many cases limits the number of engineering steps that you can perform to create the desired cell therapy product. So bringing us to the purpose of today's focus session is a lot of these challenges can be addressed if you utilize iPSCs as a starting source instead of patient drives as a cell source. So at Fate Therapeutics, for the past 8 years, we've been developing an iPSC program where we generate iPSCs, and at the iPSC cell line stage, we do multi-step precise genetic engineering. Once we have our engineered cell generated, this can be expanded and generated, put into master cell banks. These master cell banks can then be differentiated into therapeutic quantities of IT cells, iNK cells, and iHSCs, which can be administered to literally thousands or an unlimited number of patients. So the key advantages of this approach is it does not require patient source cells. It enables virtually an unlimited production of cells with unprecedented scalability. We have unmatched genetic engineering capability because, again, at a cell line, you have all the time in the world to do step-by-step, multi-step engineering. And finally, we are able to achieve homogeneous and reliable product forms from a manufacturing perspective. So again, we believe that this iPSC approach really addresses many of the critical limitations of patient source cell-based therapies, and that's going to be the focus of some of the presentations that you're about to hear.